As the nationwide drug crisis continues here in our state, we're seeing some grim numbers.
A new report from the Department of Health and Human Services shows a 40% increase in drug overdoses in 2020. Now on your sides, Claire Mollet is here in studio now. Claire, you spoke with DHHS today. So what do they say is contributing to that number?
Courtney, they say this biggest factor includes stress and challenges related to the COVID pandemic. And with the 40% increase, that means about 9 North Carolinians are dying per day from overdoses. Health officials add they are seeing some changes in substance abuse patterns over the past couple years.
Yeah, early on we saw that the increase in prescription opioids was one of the primary ways that we saw the issue and the opioid overdoses increasing generally. Now we're seeing that shift more towards, again, non-prescription opioids, things like fentanyl, heroin.
Senior Deputy Director for Public Health, Dr. Susan Cassandra, says it's crucial to not only work to improve health, but also communities as we fight this crisis.
And addressing upstream factors like housing and employment and transportation, those things that we know are so important to many different things, including health.
It's a bit of a catch-22. ECU's chair of the Department of Psychiatry and Behavioral Medicine, Dr. Michael Lang, says as doctors have cut back on opiate prescriptions, more people have turned to purchasing drugs illegally.
Well, the amount of heroin that people are going to, given the lack of supply coming out of the prescribers, is going up. And so the illegal, the underworld is meeting the supply and demand from prescribers pulling back.
He says we need to do more.
We have a tremendous deficit in Eastern North Carolina in available substance abuse resources. The resources that we have are stretched thin at this point.
And the NCDHHS says as a state, they are responding in a number of ways.
One, we have our opioid action plan, which is substance use and opioid action plan, which is up on our website, and really working with multiple partners across local governments across the state.
The NCDHHS says they are also getting ready to deploy 15 mobile health clinics to provide treatment in hard-to-reach areas. In studio, Claire Mollet, 9 on your side.